You are watching 2+ U Nevada, and we are at Renowned Senior Care Del Monte Clinic. Joining us again, Dr. Francesca Ronaldo. Thank you so much for having us this afternoon. And Norm Lamont. Norm, you are a Senior Care Plus member, and we are here today to talk about something super cool. And that's something that Senior Care Plus members can get, a Care Connect visit. So, Dr. Francesca, tell us a little bit more about that.
So every Senior Care Plus member is eligible for a very comprehensive annual exam that we call the Care Connect visit. It's really a chance to come in, see one of our providers, review your medications, review your medical conditions, and also make sure that we're setting you up for success for the rest of the year. So we talk about things like durable medical equipment, whether you need specialty referrals, anything that might fall through the cracks in terms of your care. We're making sure that we're addressing that. It's really just to wrap up your care in a nice package so that you're set for the year and we're making sure that nothing's falling through the cracks.
And what I love about this, so this is not like your typical doctor's appointment. And I've been told by my friends in the medical business that if you get 15 minutes sitting down in a chair looking at a physician, that's about the average. But how long are these appointments?
So these appointments range between 40 and 60 minutes.
Wow.
You really have a lot of time to sit down and do a very comprehensive review of all your conditions, all of your medications, any other barriers you might have to care. You really get a lot of face-to-face time, not just with our providers, but with all the other staff that we have available to help you here in the clinic. So we have our RN care coordinators and care managers, we have our social workers, our community health workers, and we have our Senior Care Plus personal assistants here in the clinic as well. So basically you're able to spend that time with the provider and then meet with other team members as needed based on the needs that are uncovered during the visit.
And this is offered once a year?
Offered once a year.
This is fantastic. And Norm, as a Senior Care Plus member, have you taken advantage of this type of appointment?
I just did it.
You just did it. So tell us what you experienced.
I'm always surprised at the questions sometimes. It's very thorough. One thing I'm always a little paranoid about is you have a what can you remember test.
Why are you worried about that?
And I fret about it before I go, but I usually do well.
Oh, well, I'm so glad to hear that. I can tell that you're doing just fine with your memory. But really and truly, tell folks what they can expect.
They sit you down and ask you a lot of questions, medication questions, if things have changed, some malady you might have had, has it gotten worse, gotten better, what's changed? Is the doctor really helping you work on it?
Mm-hmm. And then when you talk about your medications, like, are you bringing in a bag with all of your pills? Like, do you do that? Is that what you're supposed to do? Or do you have the list from your MyChart?
We have all of their medications available in the electronic medical record, but if Senior Care Plus members want to bring their medications and review those with the providers, they are more than welcome to do so.
You know, this just sounds so cool because it sounds like you're really sitting down with your patients, taking stock of what their needs are. But this particular appointment, it's not necessarily a doctor's appointment. You then, after this, schedule those appointments that might be needed after you really get all this information.
Absolutely. This is not intended to replace your primary care provider or a visit with your primary care provider. What we're really trying to do is get ahead of gathering all of that information ahead of time so that your primary care provider can actually spend those critical 20, 25 minutes with you to discuss what the most active issues are. What are the things that are top of mind for you that you're worried about in relation to one of your conditions or a medication or any other issue? We're really just wrapping it up for them so they can focus on the things that are most important to you in their visit with you.
And I want to key in on something that you just said in your answer to my prior question. You said 20 to 25 minutes. One thing that's so important for folks at home to know is Senior Care Plus members, when they come to this location, they really and truly do get a lot of sit-down time with their primary care provider.
Yes, our routine appointments with our providers here, whether they're primary care providers or one of our Care Connect visit providers are 40 to 60 minutes. So we actually will take a look at your chart ahead of time, and based on the complexity, if we know you have a lot of conditions to discuss, if we know you have a lot of medications or other potential issues that we need to address, we'll actually schedule those visits accordingly so they can be 40 or 60 minutes.
Norm, as a patient, does this make you feel heard?
Yes, my favorite thing is the My Chart. It's easy to make appointments. You usually can get an answer. I'm constantly surprised. I'll ask the doctor a question and you just type it in the computer, and usually within the hour you're going to hear something back, which is
That's awesome.
great.
That's great patient care. Well, thank you so much for joining us, both of you, this afternoon. Really appreciate it. Dr. Francesca, I hope to see you again soon.
I hope so too.
You're watching 2+ U Nevada.